Hello, I'm very pleased today to be able to present to you a retrospective analysis of a randomized study and an open label study to evaluate the safety and the efficacy of OK-432 in patients with lymphatic malformations. I will be representing my co-authors listed here, and I'm a professor at the University of Iowa Hospitals and Clinics. As you all know, lymphatic malformations are rare congenital anomalies that most commonly arise in the head and neck in children. They rarely resolve spontaneously, and in the United States, there are no FDA-approved therapies for their treatment. OK-432 is an immunotherapeutic that's derived from non-viable strep pyogenes treated with benzylpenicillin. It's been approved for the treatment of lymphatic malformations since 1995 and is currently the standard of care for these lesions. The purpose of the study that I'm going to share with you was to evaluate the efficacy and safety of OK-432 in patients with lymphatic malformations in the United States. This was a randomized study that was conducted between 1998 and 2005, and also an open label study that was conducted from 2005 to 2017. In the randomized study, subjects were randomized in a 2-to-1 fashion to either receive immediate treatment, the immediate treatment group, or to receive delayed treatment, the delayed treatment group. In the open label study, all subjects were enrolled and received immediate treatment. The treatment consisted of 4 doses of OK-432, spread approximately 6 to 8 weeks apart, and in the randomized study, the efficacy was assessed 2 weeks postoperatively or post-treatment, and in the open label study, efficacy was assessed about 1 to 6 months after treatment. The treatment effect was analyzed with respect to clinical success, and then also spontaneous resolution by using a logistic regression model, and data were analyzed as observed. With respect to the demographics and the baseline characteristics of the patient populations, in the randomized group there were 246 patients, and in the open label group there were 275 patients. The majority of the subjects were between 6 months and 18 years of age. As you can see from the chart on the left, there were a wide range of presentations. The majority of lesions were macrocystic or mixed lymphatic malformations, and some of the patients, about 10 to 12%, had undergone prior surgical procedures. The primary efficacy endpoint in this study was clinical success, which we defined as a complete or substantial reduction in lymphatic malformation as measured radiographically. In the first study with the randomized subjects, about 70% of subjects demonstrated clinical success in the immediate treatment group. In the delayed treatment group, 7.5% of subjects showed spontaneous resolution of their lymphatic malformation. The delayed treatment group after 6 months went on to receive treatment, and the treatment effect in that group was 65.6%. In the open label study, 73% of subjects achieved a clinical success. There were local and systemic reactions associated with this treatment. The local reactions consisted primarily of swelling, some injection site pain, and some redness. The systemic reactions consisted of fever, a decrease in appetite, and fatigue. The local reactions were more common than systemic reactions, and both the local and the systemic reactions peaked within the first few days and resolved within 2 weeks. With respect to treatment emergence serious adverse events, these were assessed by the investigator giving the therapy, and in the randomized group, that assessment was at about 4.6%, and in the open label group, about 1.8%. Long term, after about 3 years of follow-up, there were no safety concerns in the treatment groups. Based on these results, we can conclude that OK-432 is an efficacious treatment for macrocystic and mixed lymphatic malformations. It exhibits a favorable safety profile, and in fact, these results are consistent with approximately 30 years of OK-432 experience reported in the literature. Thank you very much for your time, and I appreciate your spending a few moments to learn about OK-432 and the treatment of lymphatic malformations. Goodbye.